Good. All right, time being 6 o'clock, I'm going to call the Board of Health meeting to order. Will everyone please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, couple of public announcements. First, at the last Selectmen's meeting this past Monday, we noted there was a charter issue, and we are reopening the applications, the Selectmen's reopening the applications to fill the Board of Health vacancy. Those applications will be due November 5th, 2021 by 12:30 p.m. And we will be voting on filling that vacancy the following Monday, so a week from today. Marty, do you have announcements from the health department?
Booster shots are still ongoing for the COVID. Anybody who received a COVID vaccine, you can get any booster shot if you received any one of the FDA-approved vaccines or UA-approved vaccines. So we have some appointment only. Please schedule an appointment through our website link. More are on the way, and we are getting Moderna. So please be patient with us as we can't take any walk-ins for that right now. The system does not really work well with that. More flu shots are also on the way, so we should be able to give more of those sometime this week. And we anticipate starting our kids clinics, 5 to 11-year-old, as early as next week, probably in the neighborhood of Tuesday or Wednesday.
Thank you, Marty.
Marty, if someone's had a COVID breakthrough case, like how long do they have to wait after COVID to get like the booster shot?
It's 10 days from the test date, or
Okay.
if the symptoms have not resolved or have gotten any better, you wait until symptom resolution.
Okay, and then you could do the booster. Okay.
Thank you, Marty.
No problem.
Moving on to old business here. Regulation review from our last meeting was prohibiting smoking in workplaces and public spaces. We were talking about how we have, I think, 4 different regulations on the books that I essentially want to combine into one. Really, we don't have a working document at the moment in front of us, nothing like that. Really, I just want to understand where the board thinks, how we want to approach combining these. Marty, do you want to talk more about that suggestion at all?
Sure. Ideally, we would have a regulation that encompasses tobacco in town, and that could have subsections of things like that. So it's basically combining the 5, I think, to better reflect the entirety of the regulation, and then to reference that with the 665 from the state. I think that's the smartest way to do it, and not a lot of people actually do it that way. I think it would just save a lot of headaches to send some people to one place as opposed to several findings.
So is this something that we take the 5 that we have, we shoot it to council and say put them together, or do we try and attack this on our own?
Both.
Okay.
We can try to attack it on our own, find some best practices. Melissa mentioned the tobacco state reps who can also help us do that.
Okay.
We should definitely leverage their knowledge and know-how. And
DJ Wilson, people like that?
I believe it's that person. I believe it's
Yep.
that organization.
Okay.
And then send them what we think we want to have. Get their feedback, make changes as you all see fit, and then submit to council for review. Bring it back, and we're done. And I think that will be significantly easy for our small business owners who sell tobacco.
Yep. Okay.
I have a question on the process. When we did we had a regulation about something left by recycling bins or donation bins.
Yep, the donation bins. I remember that very specifically.
Okay, thank you. So,
I remember we decided to send it to council before the board approval, so we can get all of the changes.
Yeah.
And then.
So like the process is, we make our changes with the board, it goes to council, they make changes, but then it comes back to us for final approval before it goes live?
So
moving forward?
If that's how we want to do it, that's how we should do it. And I think
Okay.
that's the smartest way to do it.
Well, that was the issue we ran into last time where
You approved.
we approved, they made changes, and then that was it.
They recommended changes, and then we had to come back and approve it again.
Well,
which is kinda-
didn't we approve them as pending town council's review, so technically that review was
Right.
valid, so I think we were trying to avoid that this time.
I completely agree. Please, let's avoid
Okay,
that.
so moving forward, goes to them, they make their changes, but comes back
Back
to
to us, and
us
then we
for
need to
final
approve them.
approval. Okay, thank you for clarifying.
Any other questions? I really, that's kind of the discussion I wanted us to have, just understand what we need to do. This will just continue to be a rolling agenda item until we get to the point where we're ready to vote on something.
I
Yeah.
do have another question. So as we're going through these regulation reviews,
Mhm.
does it violate open meeting law for us to be, like, if I have a draft and I'm looking at body art, for example, and I make my changes and send it to the board and people make changes and go back and forth, does that violate open meeting law, or do we need to make all changes to like a draft in this setting? Because I can just see like the back and forth is gonna take forever.
Well, I would think that you probably have a point person, right, to,
So you send them back to me, and then I
Right.
make changes as requested and or discussed, and then we'll promulgate from there.
Okay.
right.
I just wanna
don't-
avoid like 40 email chains back and forth on every
Right.
little word.
Yeah, I don't think it's appropriate for us to go back and forth and say, this is how I think this should be worded, but,
Mm-hmm.
to the entirety of the board, but we can find a way to collaborate in a more appropriate manner.
Okay.
And I'll track all changes to the document.
Okay.
That's usually how I do it.
Okay, great. Any other questions, comments?
With that, under the regulation review, me and Chris are
Yeah.
still doing that for every other one right now.
Awesome.
Trying to figure out what's the triage, borrowing a medical term, what should be next, and the website's use of those. Because the website needs some serious updating, and I think everybody kind of knows that, and we're working on that as we are. So we're trying to go through all of them to find out, what we can recommend you guys target next.
Yeah, and that's kind of been, where, when stuff ends up on the agenda, I'd be talking to Chris or me talking to Marty and saying, all right, this is something that we may need to look at. So if there's something you notice or anything, that, please let the health department know and we can go from there. Okay. Hearing no other discussion, we can move on to our new business here, which is the regulation review for the body art regulations. Chris was awesome enough to put together this updated version, which we all should have a copy of. The section of note is section 12, which is guest body art practitioner. If I can open up to that section. There were, amongst the document, there were a few grammatical changes as well, but things like adding a parenthesis where there wasn't one or removing one and such.
And those changes were page 20, I think.
Yep, and it seems as though they've been highlighted in here. Yeah.
On page 20.
So I believe before the established regulation, the licensing fee was $100. So the suggestion is to lower that to $50. And Chris, what was this C that you're highlighting here?
Sorry, what?
What's the change here on C? Do you know?
There were two different things which were repetitive, so I just brought it down to one, which is proof of licensure in another community or location. I think there was another line saying.
Yeah, it was a line that said, please provide acceptable documentation that they meet the training requirements and a specific instruction that was not ours, so we just struck that.
Okay.
And then as long as someone is permitted to perform tattoos in another place for more than 2 years, so 3 was the update, and what the line that was 4 was struck from the regulation because it did not apply.
Okay.
So what's the logic on someone who is licensed to practice? Like, they have a license to practice this. What's our logic for saying that they are not permitted to have full practicing rights unless they have 2 years of experience? Because if they're already licensed by that regulatory place and saying they're experienced and can operate, why would we require like something more?
That's just standard practice. If you want
Yeah.
to lower it, it's well within your purview to do so.
So, and this is for a guest practitioner as well.
This is specific to guest practitioner, and that's it. That's so someone flying in to do a flash at one of our local establishments, as some superstar tattoo person's coming in to work a day,
Yeah.
this is the fee that they would pay. So if you want to get rid of the at least 2 years and change it to something else, you're absolutely within your right to do so.
So this is, if I'm interpreting this correctly, they need to provide 2 years of permitting proof.
That's
to
it.
us. Okay.
But they would have to be licensed within the state. Like, you can't be licensed in another state and just come out here to Massachusetts, and you have to be licensed in this state to practice. I mean, that's as I understand it, right?
When you say licensed in another, so there's no state license for tattoos, it's all local.
Okay,
So if someone in Boston is tattooing, they're specific to Boston. So if someone from, I don't know, California wanted to come out here, wherever their license is from,
mm-hmm,
if they have one there and they
Yes.
bring proof to that, then we should issue them a 1-day or a temporary 2-day for their flash event.
okay, and I'm sorry for the lack of awareness. This got sent to us the same day, and I have not had a chance to go through it. I guess what I'm curious about is if the licensing standards are different in different towns. Like, someone comes in from California, and maybe they say, hey, you need 1 day of apprenticeship to get licensed. I can understand us saying, hey, 2 years of experience.
Right.
But are we applying like a heavier standard for people that are fully licensed to operate? I just don't understand why we would.
Honestly, I don't believe there is a like general rule for that. It
Right.
is just specifically best practices as
Yeah.
opposed to hard and fast rule.
Okay.
There's nothing that says you can't say if they have a license, they're allowed to do it here,
Okay.
regardless of how long they've had it. That is honestly just a
Best practice.
best practice.
Right.
Yeah.
Yeah.
Okay.
Is there any other discussion or questions from the board?
I have no discussion. Would you be ready to vote, or were you?
I would entertain a motion if there is one on the floor.
Okay. I'll make a motion to accept the changes as written on section 12 on page 20. As written.
I'll second that motion. Any other discussion? Hearing none. All in favor of the motion, Kevin, to accept the changes as written on section 12, signify by saying aye.
Aye.
Opposed?
No, opposed?
Okay, majority. Do we need to take a vote to accept any of the grammatical changes on there? No? Okay. I didn't think so, but wanted to ask a question. All right.
As always, if there is, I'll make sure. I will double check because
Thank you.
I like to do that, but I do not believe so.
Okay, those are approved. And that's it for the items on our agenda. We can entertain a motion to adjourn.
I'll make a motion to adjourn.
Second?
I have a motion to adjourn by Christina, second by Kevin. Any discussion? All in favor? Aye.
Aye.
Opposed? It is unanimous. We are adjourned.